As a physician who's walked alongside countless patients through the journey of reproductive health, I understand the mix of anxiety, hope, and uncertainty that can come with a missed period, especially when you're wondering whether or not you might be pregnant. One of the most common questions I hear from women's, "Doctor, how many days after a missed period should I take a pregnancy test?" It's a great question, and the answer isn't always one size fits all. In today's video, we're going to walk through exactly when and how to use a home pregnancy test effectively after unprotected sex. I'll share what's happening inside your body hormonally, what symptoms to look out for, and why timing matters so much in getting accurate results. Whether you have a regular cycle or your periods tend to be unpredictable, knowing when to test and how to interpret the results can help you feel more confident and in control of your reproductive health. And remember, you're not alone in this process. This is about empowering you with knowledge that's rooted in science and delivered with care. Let me start by reassuring you, it's completely normal to feel a mix of emotions when your period is late. Whether you're actively trying to conceive or not, that little window of uncertainty can feel overwhelming. But with the right information, you can take steps that are both practical and empowering. When should you use a pregnancy test? One of the earliest and most common signs of pregnancy is a missed period. Over-the-counter pregnancy tests work by detecting a hormone called HCG, human chorionic gonadotropin, in your urine. This hormone starts to rise about 10 days after fertilization. If your menstrual cycle is regular, about 28 days, it's generally accurate to test 2 to 3 days after your missed period. But if your cycle is irregular, which is quite common, you may need to repeat the test every 3 to 5 days for a more reliable result. What affects test accuracy? Timing is everything. Testing too early can lead to a false negative, simply because your body hasn't produced enough HCG yet. Here are a few tips to improve accuracy. Use the first urine of the morning. That's when HCG levels are most concentrated. Avoid drinking excessive fluids beforehand, which can dilute your urine. And keep in mind, even the best home tests aren't perfect. False positives and false negatives can happen. That's why I often recommend following up with a blood test or ultrasound for confirmation if there's any doubt. When should you see a doctor? If you've missed your period for more than 2 weeks and home tests are still negative, it's time to consult your physician. A simple blood test can provide a much clearer picture. You should also seek medical care immediately if you're experiencing symptoms such as lower abdominal pain, fatigue, dizziness. These could be signs of ectopic pregnancy or other conditions that require prompt attention. And remember, a long delay in menstruation without pregnancy could be a sign of an underlying health issue that shouldn't be ignored. What else can cause a missed period? Not every missed period points to pregnancy. Other common causes include stress, significant weight changes, travel or relocation, changes in your work or daily routine. Our bodies are incredibly sensitive to changes in the environment, emotions, and habits. So if your cycle shifts occasionally, don't panic, but do pay attention. Monitoring your cycle regularly and noting any changes can be a powerful tool for protecting your reproductive health. And if you're ever unsure, please don't hesitate to talk with your doctor. That's what we're here for. Before we wrap up, I want to leave you with a few important thoughts. Home pregnancy tests can be a useful first step when you're trying to understand what your body is telling you, but remember, they're not infallible. Their accuracy depends on several factors. When you take the test, how concentrated your urine is, and where your hormone levels are at that moment. A test taken too early or after drinking a lot of fluids may give you misleading results. So if you're feeling unsure, if your symptoms persist, your cycle doesn't return, or something just doesn't feel right, please don't hesitate to seek medical care. A brief visit to your doctor and a simple blood test can give you much more clarity and peace of mind. And above all, don't panic if your period is late. Life's changes. Stress, travel, shifts in weight, or sleep can all impact your cycle. Keep track of your body, note any unusual signs, and reach out to your healthcare provider if something concerns you. You deserve answers, and you deserve compassionate care. If you found this video helpful, I encourage you to like it, share it with a friend or loved one, and subscribe so you never miss out on reliable, physician-backed health advice. We're here to support your well-being every step of the way. Take care and be kind to yourself.